Hi, everyone. I am Shreya from Lexicon, the medical magazine, and today we are holding a very special interview. Let me introduce you to Dr. Ripudaman Singh, who matched into internal medicine program at St. Peter's University Hospital, New Jersey, in the match of 2022. Not to forget, Dr. Ripu has been a part of Lexicon since a long time now and has contributed to the magazine in countless ways. Welcome, Doctor. It was really kind enough of you to make time for this interview.
Thank you so much, Shreya. Pleasure's mine.
So I'll start with congratulating you. And
Thank you.
I'm sure it was like a big journey, it was a long journey for you.
Yes, like everyone says, USMLE ends up being a very long journey, a very tedious process. But hopefully the ends that matters, and I'm happy to
Exactly.
be on the other side. Yes.
Exactly. Great. So I would not take much of your time. So we'll directly jump into our questions. So after the results came in, did you already expect that you'll match here, or were you surprised?
So, the time from your last interview, even if it's in January or February starting till the mid-March when you get your results,
Yeah.
it's a period of time when you're very nervous and you're excited, but you're also scared.
Yeah.
So all these emotions club in, and you can never be pretty sure that where you're going. It's full of emotions, I would say. That's the only thing I'd say.
So like I have seen so many YouTubers making a video of their reaction. Did you try any of that?
Oh, I think I missed on that. So I was in California at that time, and it was 6:30 a.m. So I don't think I was in a state where I was gonna record myself. So and I was just so scared. Like when the results day come closer, that's just me. I just start praying. I was actually praying. Yeah.
Did you like tell anyone else to open the email and check the result for you?
Oh yeah, so my sister actually helped me all along the process so that I don't miss any email because you get a lot of emails. So yeah, so she also opened it at the same time, and then she called me in 1 minute, and it was
That's
it
great
was
to
a
know.
very emotional moment.
Okay, so how long was your entire journey? When did you start preparing for USMLE?
So I had in my mind around the end of my second year of MBBS that I wish to pursue USMLE, and no particular reason, but I think I'll go on that journey. I started with some volunteer works and improving my hobbies and interests, but the actual studying part, I think for the step exams with the board materials, I think I started in my internship.
Mhm.
But before that, I would just touch upon some books for my subjects as well while studying for my prof exams. And I think that did help. For example, I did pathoma for pathology with my pathology course. I think if that could be clubbed in, it would be a really good idea.
That's great to hear. So, since you took your steps during your internship year, so how were your scores at that time? Were you like a great scorer at the Emily's?
So actually I ended up giving all three of them. I gave my step three during my interview trail. So I scored 80th centile in two of them, and then I scored a 50th centile in one of them. But I was applying for internal medicine, and I think I was pretty happy with my scores.
That's great. So usually we see like a lot of people are stressed about their score, that if they did not score more than 230 or 220, then they'd be very stressed. What do you think? Can they improve the chances of matching even with that?
So to be honest with you, yes, some programs do have a cutoff limit. They get around 4,000 to 5,000 applications. And then some of them use it as a screening tool to screen people. But before you're applying, they have the requirements mostly given. So they'll tell you that if you have a below 225 score, do not apply, which makes sense. But a lot of people make it through. It's not make or break. But the only thing would be that I would suggest is if you score lower on one aspect of your application, just try to compensate it. So, for example, someone does not perform that well on the exam day, which could be really unfortunate for someone. But that person could actually improve by doing more research or getting more US clinical experience. So, it's all about your overall application and not just you're totally focused on the scores.
Right, right. So it's like a holistic approach.
Yes, yes.
That's right. So I'm sure your timeline was between the COVID time period as well. So
Yes.
how did that affect your journey?
So COVID actually played a very dramatic role in my application. I actually booked my step one for the March of 2020. And that's when our Prime Minister Modi ji announced all these lockdowns. So interestingly, my step one exam was pushed 5 times.
Oh,
So
okay.
yes. So I was originally supposed to take my exam in March, but due to the continuous lockdowns and the Prometric Center closing in Gurgaon, that's the closest one to North India, I ended up giving that in June. So for 3-4 months, I was actually in a lot of state of panic because I have done all that I want to study and I did not want to study more. I was feeling burnt out. But at the end of the day, my mom always says it's with everyone, Ripu. It's not just with you. So I kept my calm and then I think it worked out. And also, the pandemic affected my US clinical experience a lot.
Oh, yes.
So I already applied for electives at two good universities in states, and I was supposed to go there in May. But you should know that the travel got cancelled, and university stopped accepting people. They cancelled all the people who were accepted, and so yeah, so my USC, like I was supposed to do electives as a student, that was also cancelled. So again, I was in a state of panic. So again, I went to my mom and she said, Tripu, it's with everyone. It's not. So yeah, I think that kept me going.
Okay. So were you able to attend the USCs later on?
Oh, so yes. So when I graduated, I happened to do two telerotations, first of all. One was with the university program and the another one with the community hospital. But I was lucky enough to get visa in October of 2021, which was after I applied in September. And after that, I did my 3 observerships at 3 different hospitals, two with the residency program. So I did not stop after I applied. I just kept gaining more experience because while in those months, you're interviewing as well.
Yeah.
So when you're interviewing, you could tell them what you're doing currently.
Right.
And that I think that did help me. So
Yeah, I think that's actually a very good strategy. I haven't heard many people doing that. So
yes, so I was doing that so that I could add up to my existing clinical experience because before that I did not have a B1, B2, the visitor visa you require. So I could only get it after I applied. So that's how the things worked for me.
and like after the step 2 CS got cancelled,
Yes.
a lot of pathways were introduced. So did you take a pathway or did you take clinical skills before that?
Yes, so I didn't do clinical skills. It got cancelled in I think 2019,
Yeah,
if I'm
okay.
not. And yes, so I took the pathway one. That is one of the most feasible pathways for students in India.
Yeah.
So we have to give our step one, step two CK, OET exam, which is the English exam, along with a license to practice in the state
Yeah.
or a country. So whenever someone graduates in India, they get this license from their state licensing board, and you could show that and you could get approved via the pathway one. So
Okay.
that's what I did.
Okay. Okay. So basically, for pathway one, you have to have your country's license or any country's license, right?
Yes.
So when is the correct time to take OETs for?
So coming to that, like firstly, I would suggest that a person should know what the criteria for the ECFMG certification is going to be for that year. Like for next year, they have announced that OET is going to be there, right? So I would suggest, because OET dates are very limited, they run short, I would suggest booking the OET date a few months in advance. And then you could study for a week or two or maybe four, depending on your English skills, and giving that exam. It's not a big of a hurdle if a person is able to communicate or understand English properly. But the dates actually pose a problem. Even my OET was cancelled 3 times. So yes, I have had this journey full of cancellations. So yeah, I was supposed to give my OET also in May last year, and then I had to give it in July. And the results also take about 3 to 4 weeks to come. And then the ECFMG takes time to review those scores. And after reviewing those scores, they are going to give you the ECFMG certification. So, the timeline has to be that a person gets the score comfortably before and then also applies for the CFMD certification in time. So
Right. And they need to be certified before we apply for the ERAS matching, right?
So it's not a requirement. A
No.
person can get certified till the match rank list deadline in the end.
Hmm.
But for foreign medical graduates or international medical graduates, it's preferable to have as complete application as you can to increase your chances, because the competition is very hard. You're
Hmm.
competing with people from their own country. You're
Yeah.
competing from students from all around the world, some of the top universities like from the UK, from the European countries, even Australia. So, you have to put your best foot forward,
Definitely.
and you could apply without it, but it's suggested that you apply only with your complete application.
Okay. Okay. That's something I'll probably keep in mind later on. So, Dr. Ripu, you mentioned that you have taken two observerships or three
Yes.
observerships and two telerotations, right? So, it's usually emphasized that people should have clinical electives done, like before graduation. So, did
Yes.
that play a role in your application? Was there a setback because of that, that you could not take that?
So basically, on a very personal level, I really wanted to attend the electives as a medical student, because observerships versus elective have a huge difference. So when you go as a medical student, you could actually touch the patient, talk to the patient, examine the patient, present the patient. You're basically a part of the team. You're acting just like a US medical student.
Right.
While in observerships, some hospitals may allow you to do all of that, but some don't according to the state law.
Mm-hmm. Right.
So when COVID cancelled my electives, I was very gutted. But then again, it was with everybody. So I just kept my calm. But if I had the opportunity, or if I have to suggest someone, I would say they should definitely go for electives.
Right.
The better the places you go to, the better your writers writes your letter of recommendation. For example, you get accepted to a university elective in your final year,
Hmm.
and you impress the person who was attending you, right?
Right.
So they give you a good letter of recommendation, and that letter of recommendation and that experience opens a lot more stronger programs for you.
Right.
So if you have, for example, a Harvard on your name,
Hmm.
and now you were lucky, or passionate enough to impress an attending from Harvard,
Hmm.
and they decided to write you a letter. So
Yeah.
you can expect some top programs from the States who can actually send you an interview, even if you are a foreign medical graduate. So
Wow.
I think that's how it works, according to my experience.
Wow. So, how do you really make connections during the electives? I think that's one of the most asked questions because a lot of IMGs are just very scared to connect. So, LORs are like totally different level.
I can totally understand that. I've faced that. And I actually mentally prepared myself for 2-3 days prior to that day when I was going to ask the attending for a LOR. But yes, that is so obvious. So for us, it's different because in our countries, we are not that openly communicating with the professor.
Right.
We have this area where, professor and, a student, and then you don't bond well unless the professor has a different approach towards teaching.
Wonderful.
So, but in United States, it's completely different. If you are working with a professor or intending, you're a part of the team, and they expect you to voice your opinion, ask questions, communicate well. And even when you are in a group, you should give your suggestions. You should be talking. You should be making sure that you are helpful to the team. And now, this helpfulness, how you're going to make it, it totally depends on the person and the situation. But I would suggest the more you get involved, the more attending feels that you are a part of the team and you're contributing in patient healthcare. That is going to help. And after that, if you think you've done well enough, or that person, you can always ask for a letter of recommendation. And even if the professor denies it and says you need to work harder, just get some more reviews and suggestions and say, I would like to be in your touch. Like 80-90% of the times, you'll probably get a hold to their email, and then you can be in touch with them. They would also say, please be in touch. And then you can email them, ask your suggestions. And they're busy, but I think a lot of people are helpful. At least in my experience, I was lucky enough to find some mentors or some seniors, also some residents who were actually doing the residency there. They agreed to help me or stay in touch, or and that is how you make connections. There could be other ways of forming connections as well. So for example, you went to a conference, it was an international conference in your own country, there came a professor, you were presenting something or you were participating in something, and you can just go and do a small talk and discuss something of their interest or your interest, or how was your presentation. And I've seen people, for example, I have a friend in CMC Vellore, so his college had this seminar where a professor from University of Kansas came. So he formed a connection with that professor for like 2-3 years, and now he got into a postdoc fellowship, a research fellowship, just because he met that professor in India.
Wow.
So it's all about you going forward, not being shy and expressing yourself. One thing I've learned in States is you need to really tell the person what you want. It's not like you're going to keep thinking about it and say, what are they going to think, At least shoot a shot.
Yeah.
If it doesn't work, it was anyways not going to work. So,
Right.
It's always advisable to take the path of doing than just thinking about what if it doesn't work.
Right. Absolutely. It never really hurts to.
Yes, exactly. I learned it the hard way, but I want to tell the audience here that,
I think I'll make that a bold point now.
Yeah.
So, Dr. Ripu, how did you actually manage to get so many interviews? I'm sure your ERA CV must be very bold out there. So, how did you try to have those extracurriculars, those voluntary work in your CV?
So one thing I'd like to tell everyone, which I don't think a lot of people pursuing USMLE their second years or third years know, that there are basically 3 columns or 3 areas in your CV. One of them being work experience, the second being volunteer experience, and the third being research experience. So your CV is filled up by these 3 columns. So I would suggest anyone listening that you need to make sure that you tick all these 3 boxes as much as you can. So for work experience, you fill your internship, or if you did a junior residency, or you did your electives or observerships, you have to fill it right there. Now coming to volunteer experience, they don't have to be only medical volunteer experiences. They could be like helping run orphanage for dogs. I don't know what it's called, but yes, or helping old age people. So you could have those interesting volunteer experiences, and they matter as much as your US clinical experience, because when you're invited for an interview, they're going to talk about you. What are you passionate about? What do you really like? And what are you as a person? So you could add interesting volunteer experiences no matter in which country you are. It's better if you have those things which are world renowned or the United States people know, because it's all about communicating with them and forming a connection during the interviews. So if they know about that and it's really impressive, they're going to be impressed even if you did not do a lot of US clinical experience. And similarly, coming to the research experience. So now research experience, that is not a necessity, but I'm telling you, there is a column which you have to fill. So no matter if someone tells you you don't need a research thing for family medicine, your CV will have that empty. So what you can do is you could contribute as much as you can. And also, for example, like in Lexicon, we publish this articles on a quarterly basis, right? So there is a column called non-peer reviewed online publications. I did not know that before. And I did not write for Lexicon because I wanted to write there. It was just my passion. But after that, I discovered that even my Lexicon publication or any publications you write in the student magazines, you could actually add them. And then and then your interviewer could actually see the title of that thing and they could be interested. So I had this interview experience where I was asked about this article I wrote on the COVID-19 myths that were going on in India, because how religious Indian people are and how, WhatsApp messages wreck up people's views.
Absolutely.
So I actually ended up narrating the first 2 paragraphs of that myth and mythology that was going on to the interviewer. And that was one of the very nice interviews I had.
Must be really funny though. Absolutely fun. That's great, actually. So in the interview process, I think this should be one of the points that made you stand out, right?
So one thing I realized was that the best interviews I had were the one where I was actually connected to the interview. I was communicating well. I was laughing. I was making small jokes. They were reciprocating. And it was a positive environment, all of there. So it's not only about writing what you have done or, putting that on your CV. Once you're in the interview, you have to show how your communication skills are, how you can, contribute to the team. Can you adapt to the surroundings? Can you be a good team player? So it comes more down to how you sell yourself, basically.
Right.
So I've seen people who have been really successful in telling their telerotation experience as if it was the best thing in the world. And then I've seen people, themselves saying that, oh, it was just a telerotation, I couldn't do much. So it's all on person's perspective and how smart and how interestingly you sell yourself.
Right.
And yes, so that is one of the things. Even after the match results, I was talking to one of my colleagues who also matched, and she told me that how she went all the way to explain how the telerotation helped her reach her goals, or how that was one of the most wonderful experiences. And then I've seen other people who did not even want to put telerotations because they thought they were not a good thing. So it's not about only going to a Ivy League and doing an elective. It's about being proud of what you have done and being proud of yourself as a person and believing in yourself and having that confidence that you're not less than anyone.
Definitely. So making the most of whatever you have.
Yes.
That's what makes you stand out. That's amazing.
Yes. Be confident.
Right.
Give your best shot. Yes. I know it's easier to say, but I have faced it. And I think I was lucky enough to feel that confidence in a couple of more interviews.
Yeah.
And I think that's what actually mattered more.
So how did you really decide which program would you rank on the topmost, and how would you go down?
Yes. So my planning to ranking was very haphazard. Like a lot of students, we struggle and we keep like thinking so much about it. But then I think I placed education program which was teaching intensive,
Right.
a program where I felt the vibes were nice, and the program where I knew that I would be in an environment where I would flourish, and I also have a support of family in the vicinity. Like I have a lot of family on the northeast states. So those were the factors that options of either doing primary care or a fellowship were open. So all these factors came in. I've also seen people making a Excel sheet and uh, ticking and crossing the points and then deciding.
Right.
But I did not make one. I went with my gut feeling, and I think I did well. Yeah.
Wow. So did you have a backup plan just in case you didn't match?
So after spending so much time, energy, resources, into this process and thinking about it from so long, and then clearing the 3 steps, I was dead sure that this is the path I'm going forward with. The only thing I knew was that could be added to my current experience was maybe a research experience in the States.
Yeah.
So probably that I thought I might end up doing a research fellowship for another year, but I did not have any backup of giving Indian NEET exam or pursuing the UK pathway.
Right.
So that would be my backup. Yeah.
So you graduated in the year 2021, if I'm not wrong.
Yes.
Right. So since 2021 till 2022, you were basically only involved in the observerships, the telerotations, and preparing for the interviews. Were any other work experience involved during that time?
So yes, so I graduated in May 2021, and then I joined junior residency, the non-academic JR is what it's called, in a tertiary care hospital in my state of Punjab. So I did that junior residency for 4 months before getting the visa. So while I was working on my V1, V2 visa. Also, I was doing my telerotation along with that.
Oh,
job, junior residency. Yes, yes,
that
I know.
must be very hectic.
I know, but sometimes it's just like that. So
Yeah.
yes, mostly I picked up a job where I was working morning shifts at the hospital,
Right.
and then in the evenings and the nights I was doing my telerotation because the telerotation is according to the US timing. So it kind of worked out. It was hard work, but yes, sincere work. So
Yeah.
yes, so after that, I did that for around 4.5 months,
Hmm.
and then I came to States, and it was the interview season and the observerships.
Okay, that's amazing. So all of your interviews were online only.
Oh yes, all of them were online. Most programs, I would say, more than 95% had
Mhm.
only online in internal medicine. I don't know about the other specialities because I only applied in internal medicine.
Okay, okay. So you wanted to go to internal medicine itself.
Oh yes,
And have
yes.
you thought of a fellowship specialty yet, or are you still discovering that?
Right now, no. Even that is what I told my interviewers, that I'm open to options and choices. I mean, I could just say a random name right now, and at the end of the day, when I do my rotation in states and I don't like that specialty, I might change. So I'm
Yeah.
not going to do that. I'm going to be honest. I'm still open to choices. I still haven't decided.
Okay. So, like, we've seen that since the time IMGs have applied to ECFMG certifications and matching, a lot of the number has drastically increased over the years. Like, what do you think has made that happen? Like, how are IMGs matching so much now and becoming more competitive than before?
So I think basically the highest match result till date was in the year of 2020. After that, in 2021, like the pandemic year, the percentage dropped. In 2022, it has again increased, but not to the level of percentage it was in 2020.
Mhm.
But yes, I think every year the US Congress opens up more residency positions, and those more residency positions are towards family medicine, primary care, or pediatrics, the fields which are required for catering to the needs of the general population. And I think a lot of new programs, US grads or the DO or the MD, they do not prefer newer programs. So one thing according to me would be that the more residency positions that open every year, more number of IMGs go into that program because US grads do not like to be associated with a brand new program. That is just my thought. I'm not pretty sure about that, but I think every year the positions increase and the number of people also increases, but then the ratio comes out to be increasing a bit. But yes, I told you last 2 years it did decrease.
But that's actually understandable because of COVID situation out here. So yeah.
Yes. So
Okay.
yes.
So my last question and probably the concluding question would be, what is your advice for all the people who did not match this year?
So firstly, I would say it's always good to connect with people and find a mentor. You can always, go to your seniors or the people you met on the interview trail or the people you meet on Twitter or your seniors who are actually done with the residency or doing a residency to actually review your whole application for you. There could be 100 reasons for someone not matching, and there could be just one for some. So it's all about introspecting and seeing what else could be done. So if someone would say, my step scores were low, so okay, so step scores stay with you. What can you do to compensate that? Can you take up a research position, or can you take up another job or something? Or you could work with one of the researchers back in India or the States, which can help you work more on your application. Or maybe it was your communication skills, or maybe your interview skills. You received a good number of interviews, but then you did not match. So the person needs to think, okay, so was I presenting myself nicely? Was I able to communicate myself? Because trust me, a lot programs get thousands of applications for a few spots. So I won't say every program, but a lot of programs do not read every word you write there. So you might have written something that is extraordinary in your application, but that could be just neglected by the interviewer because it's just an hour-long thing where they have to assess you, judge you, look into your CV. So it's about, again, how you sell yourself, how you're presenting yourself, how you're telling them how you can be an asset, and how could you be a team player and overall. But again, finding a mentor, if you lacked one of the aspects, if you did not have a US clinical experience, try to gain that. Embassies are still having a lot of backlog, but you could always try your luck finding a research mentor or doing a research fellow, improving your volunteer experiences, something you're passionate about. And also, if you have an extracurricular, just expanding on that, showing interest in. If you paint well, just some people I've seen, they hung a nice portrait they did on their back while in the interview, so that could be talked about. Just being interesting, just trying to be creative, and I think it works. It will work out for everyone who has put in the hard work, and I wish everyone the best of luck.
That's a really golden advice, I think, because it's more about the personality and how you can still match, still another year. So,
Yes,
with that, thank you so much, Dr. Rupu. It was amazing. I think talk was really good, and I'm sure it'll help a lot of people, both who are preparing for the next year and who did not match. So, thank you so much for taking out time. We only
I
wish.
had a great time, Shreya. Thank you so much for
Thank
this opportunity. It was wonderful connecting with you guys.
Thank you. And Lexicon is very grateful because now this is
So
the
I
season.
am more grateful to Lexicon than Lexicon is ever going to be grateful to me. But yes,
Thank you so much, Dr. Rupu. Thank you. And good luck
pleasure all
for
mine.
your future.
Thank you so much. Good luck to you as well, Shreya.